And as India bans the export of COVID-19 vaccines and diverts its stocks for domestic use, Kenya and many other East African countries are running out of stocks, sending chills across the region. But tonight, Kenya is expecting a consignment of the AstraZeneca vaccine from Denmark, a much-needed shot in the arm. Our Eunice Omolo is live for us at the Jomo Kenyatta International Airport, where that consignment is expected in about an hour's time. Eunice, good to see you. Good evening. What more can you tell us? What time are we expected to really get more news on the arrival of these vaccines?
Thank you, Zain. As you've mentioned, we're waiting for the plane to touch down at Jomo Kenyatta International Airport. And already we have the Danish officials, we have the Ministry of Health officials already here to receive the consignment of about 350,000 vaccines that will really match up in terms of bridging the gap that we've been seeing or experiencing in terms of getting the COVID vaccine in different inoculation centers. And at the moment, we have a heavy presence of police officers who are manning some of the storage vehicles that are going to carry the vaccines from here to the main storage facility in Kitengela. And maybe just to give you a brief on basically what has been going on in terms of vaccine shortage, not only in Kenya but also in Africa. So far we have 22 million people who've been vaccinated in Africa, accounting for about 22% of all the global vaccinations. So far in Kenya, we have about 1.1 million people who've been vaccinated in total. And then we have around 192,000 people only who've received the second jab. And according to World Health Organization, most of African countries rely on the 30% free vaccines from COVAX. And since there's been a challenge, as you mentioned earlier, in terms of getting these vaccines from the Serum Institute in India, owing to the second wave of the vaccine that has been troubling the country, there's been a challenge in these countries getting the vaccines. Hence, now we have other countries that have excess vaccines donating to countries like ours. For instance, we are getting the vaccine from Denmark today. And we had a sit down with Barbara Neil, who is the country president of AstraZeneca, the African cluster. And she gave us a reason on really what is going on and how this is going to be taken care of. Watch this.
Have more than 77 million doses that has been supplied to low and middle income countries, with 38 countries in Africa benefiting from the AstraZeneca vaccine. Obviously, due to the devastating second wave that has happened in India, we have seen that supply into Africa has reached a critical point. And this is something that we are working with our partners on. And we stand very much united with what the WHO has said, that the COVAX and the Vaccine Alliance now need to work harder than ever together with the Ministries of Health, like what we are doing here in Kenya, for the countries that need supplies in Africa, as well as the countries that have enough supplies to donate. So if we look at the Serum Institute of India, which has been a trusted partner for Africa for vaccine supply over many decades, is because of the devastating second wave that's happening in India at the moment, that at the moment the exports are not happening. But they have given their commitment that as soon as the situation in India improves, that the exports will happen again. So what we are doing at the moment is, because the situation is quite critical right now in Africa, is that we are now at the moment working very closely with the countries that have high quantities of vaccines that they can donate, in a way to serve as a bridging for the situation that we currently have. That we are seeing more and more countries stepping forward to make donations. And we see that this mechanism is already working. We have seen donations going into geographies such as Rwanda, we've seen Senegal, Lesotho, Burkina Faso, so in many countries, and also here in Kenya. We know that the Danish government has committed to donating doses to Kenya, and we want to commend the Danish government for taking that step. And I think also to the Minister of Health here in Kenya, as well as the head, a combination of private companies as well as governments have pledged an additional $2.4 billion to COVAX. So this means that COVAX now have 1.8 billion fully funded doses that they can supply into low-income countries during 2021 and into 2022. And we need to now work together to ensure that countries such as Kenya and other African nations get the vaccines that they need. the data would clearly suggest that if you get the first dose of AstraZeneca, you should get a second dose of AstraZeneca. However, there are a lot of ongoing studies looking at vaccine mix at the moment, and we should probably have the evidence around that, I would say, in the next couple of months. I feel really confident that we can ensure that the right level of doses will become available.
Well, indeed seems to be some hope in terms of breaching the gap in terms of shortage of vaccine in the country. So far so good, African countries are expecting to vaccinate at least 10% of the population by September. So far so good. Kenya is waiting to be part of 47 countries that are looking forward to having vaccinated 10% of its population by September. Thank you, Zain. Back to you.